My name is Dr.Wolfe. I'm a board-certified plastic surgeon practicing in Denver, Colorado. I've been in practice for 15 years. I specialize in elective cosmetic plastic surgery. One of the things I do most frequently is breast augmentation. I do in the neighborhood of 300 to 350 pairs of implants a year. I consider myself an expert in augmentation in terms of implant technology, but then also the technical aspects of the surgery itself. We spend a lot of time with patients during a consultation discussing the different options. It's an increasingly complex operation, and it's gotten more complex over the last couple of years. We are subject to FDA regulation, of course, and so there may be implants available around the rest of the world that are not available here. And for a long time, we were limited by what was available in the US. 3 years ago, the FDA opened up the floodgates to some extent in terms of different implants, and so now we've got a much broader array of implants available to serve patients. And because of that, we can be much more specific in targeting a certain patient who may want a certain look or a certain feel, and that way we can be very specific with the implants. If you look at different types of implants, there are 3 types of implants available in the US now. We have standard saline implants, which have been around for a long time. They really haven't changed much over the last 30 years or so. It's not a particularly popular implant. It is essentially a medical water balloon. It's a silicone plastic shell. They come empty, we fill them up through the fill valve with sterile IV saline. It's an implant that works well enough in certain patients that they may choose it. It is not an implant that feels particularly natural. It doesn't look particularly natural, and so it really does best in someone who's got a lot of soft tissue coverage. If it's a patient who's a little bit heavier, who has a fuller breast to start, then the qualities of the implant are not going to be translated through the skin, and so you can get what is still a very natural looking, very natural feeling result with the saline implant. One of the bigger advantages of saline is it's very easy to deal with in terms of long-term screening for deflation. This implant is filled with IV solution, and so if the implant was ever to leak, your body absorbs that saline typically over a day or two, and you wake up in the morning and your breast is flat, which is a fairly straightforward observation, and you can give us a call. We can get typically patients into surgery within several days and swap their implants out, which takes 20 minutes or so. So very straightforward implant to deal with. The downside is it does not feel like breast tissue, it doesn't look like breast tissue, so it's something that perhaps 5 to 10% of our patients will choose. Standard round silicone implants are a much more popular alternative. It's an implant which has the advantage of really feeling like breast tissue, and so it's much less noticeable in terms of how it looks, it's much less noticeable in terms of how it feels, and there's a very, very broad range of shapes and sizes. If someone wants a very natural look, we can pick a smaller, flatter implant that's not going to look augmented. And as the implants get bigger and rounder, they're going to look more artificial. And so someone who wants a more augmented look can also certainly get that with a round implant as well. They come in smooth and textured variants, and the implants are the same. The difference really is the shell. And a smooth implant is going to move around a little bit more within the breast. It is probably a bit less noticeable in terms of how the implant feels because the shell's a little bit thinner, and so it's an implant that can move very naturally within the breast and it can feel very natural. The downsides are in certain patients, someone who's got either a large implant and or very flexible soft tissues, someone who's had several children, somebody who's a massive weight loss patient, the soft tissues may not be strong enough to hold up the implant, and so in those patients, we may opt for or recommend a textured implant, which has got a grippier surface. And so that's an implant that's going to be more stable within the breast. The downsides of texturing are the implant may be a little bit more noticeable. So that's one of the distinctions in terms of why we may use one or the other. Probably 50 to 60% of what I do are round implants. It's really a workhorse of the industry. I do a lot of shaped implants, and so these are newer implants affectionately known as gummies. Got approved in the US a little over 3 years ago, and they offer some advantages and some disadvantages relative to round implants, but what you've got essentially is a solid silicone that can be molded into different shapes, and so it's more cohesive compared to a standard round implant. And we have more flexibility to pick implants that might be taller or shorter. And so you've got an implant that can be taller than it is wide, you can have an implant that is shorter than it is wide, and that can really be helpful in matching certain breast shapes. But regardless of which shaped implant you choose, they are all textured. These need to be positionally stable within the breast, and so the friction of a textured implant is going to hold it in place within the breast. Advantages of gummy or shaped implants, they do have a different shape. And so it is something that certain people will gravitate towards. When I put them on my desk, I have a lot of patients who look and say, well, that looks like a breast to me, and that appeals to me. Or my friend has gummies and I think they're great. And so they may choose them. They have lower failure rates than standard round silicone implants. And so most round implants will have in the neighborhood of a 10% failure rate per patient in the first 10 years. Gummy implants from the various manufacturers are typically about half of that. And so that can be an implant that might last significantly longer for a given patient. And so all of these implants work very, very well. The key is to try to match the appropriate implant to the patient. And I spend a lot of time talking about it. Many patients will have an idea coming in terms of which way they might lean. Sometimes those inclinations are upheld during the consultation, but a lot of times patients come in thinking one thing. They may have read about saline and think that saline might make good sense for them, and then you put it in their hand and they may not be so interested in saline anymore. And so we spend a lot of time talking about implants. The physical exam is very important in helping a patient decide what kind of implant they're going to choose, because the certain body types in terms of soft tissue coverage, bony anatomy, breast shape may lend themselves towards a certain type of implant. We also have a 3D imaging system called the Vectra, which is very, very helpful to help patients decide between a round and a shaped implant, because you can put it's a 3D high-resolution scan of the patient, and it will insert digitally any implant that you like into the breast and show the patient their own before and after. And the advantage of that is you're not looking at a before and after of somebody else where they may have a very lovely result with a certain type of implant. If you don't happen to look like them, that's not necessarily predictive of what you're going to look like. And so seeing your own before and afters is essentially a sneak preview of what a given implant may look like for you. And that, I think, is very, very helpful in helping patients choose, are they leaning towards a shaped or a round implant? They may simply have a preference one way or the other. We do size patients with different implants, different inserts that you can put into a bra to get a sense of what a given volume is, and then using that as a guide. If you're in the neighborhood of 300 cc's, then we're going to use that to help us choose what kind of implants we're going to put into the Vectra 3D imaging system. It's highly accurate. A number of different studies have shown that it really does predict very accurately what someone is going to look like with a given implant. And between trying them on and doing some measuring and doing the Vectra, I think we're very, very good at getting patients into an implant that works quite well for them. It's incredibly rare to have somebody come back and wish they had a different implant. Once or twice a year, somebody feels they may want to go bigger or smaller, but by and large, virtually everyone ends up with an implant that they really like.